And joining us in studio is Dr. Ghavami, my colleague. Welcome. And what you have come up with is what you call your flash recovery breast augmentation. Tell us about that.
Well, the term flash is really kind of a tongue-in-cheek term that one of my patients came up with. But really the gist of this, it's a recovery system that's quick and rapid in essentially less than 24 hours. And I was lucky enough to learn it from one of my mentors, Dr. John Tebbets in Dallas.
My colleague, too.
Dr. Tebbets described it really in 2002, but a lot of surgeons weren't believing it and weren't catching on. They wanted to stick with their old ways of more kind of brutal, barbaric dissection techniques.
These don't look brutal and barbaric, do they? But you're absolutely right. That these are the dissectors that we used to use in pulling that tissue, separating the breast tissue from the chest wall and then inserting the implant. So what you're saying is you have now changed it. You're doing your entire surgery with these two instruments, correct?
Exactly, yes. And so all those instruments do is really generate heat and cautery. And we've had that for years and years in surgery. But, you know, a lot of surgeons don't know how to use it precisely in breast augmentation, and they tend to use one of the most dangerous instruments, which is really the finger. Going in there and dissecting and ripping muscle and shredding the tissue is going to cause injury and trauma to your chest wall. So obviously your recovery is not going to be smooth.